Good evening, sir. So you are completely audible. Shall we start?
Yes, Fatma, thank you so much.
So good evening, all the aspirants present here. The topic for today is endocrine disorder. And the speaker that we have here is Dr. Suvadeep Sen, sir. He is a consultant ICU at Apollo Hospital, Navi Mumbai. Yes, sir. So you can start sharing your PPT.
Is my PPT visible?
Yes, sir.
Just let me put it in the.
Aspirants, this is going to be an interactive session. Any doubt, any question, you can write it in the chat box. And also you can unmute yourself.
My slide is visible. Is that okay?
Yes, it's perfect.
Hi, good evening, everybody. Just let me see. Okay, so there are a good number of participants today. So I hope everybody of you are planning to prepare. You are preparing for your EDIC Part 1 examination. Uh, can you hear me, everybody? So as Fatma has said, I would try to make it a little interactive kind of session. In EDIC Part 1 examinations, it is basically a multiple choice question, and I would like you to have a kind of interactive sessions over here. So we'll discuss few MCQs, and where I would like to know that how much you have prepared or not, and then how much you can give you can just put your answers over here, and we can start. Okay, in today's session, we'll discuss the different topics of the endocrine disorders. We'll try to cover various kinds of thyroid disorders, adrenal disorders, diabetic emergencies, calcium and sodium disorders, and electrolyte disorders. We'll straight away start with few of the questions from few of the MCQ questions that are commonly asked in the EDIC Part 1 examinations. As you can see that whenever you see the questions over there in your whenever you're able to see the questions there, you just read the questions and then try to give answers from your side. And once we get the answers from most of you, then we'll try to discuss regarding the correct answers. And in the process, we'll discuss the various disorders and try to understand different questions and answers. So we'll straight away go to the first questions. So I think I have already taken one detailed uh, I've already taken a kind of detailed uh, session on endocrine disorders, where I have discussed a lot of theoretical aspects on the endocrine disorders in ICU. Today, I will make it a kind of more question and answer based scenario, because I feel that the exams are quite near, and in the while we discuss the question and answers, so we'll try and understand the reasons for all this. The reasons for all these correct answers. So here, this is a kind of very basic questions on the thyroid disorders that we can see. So a 36 years old woman sees her general physician complaining of fatigue, 4 kg weight gain, dry hair and skin. On clinical examination, she has small diffuse goiter. Her TSH level is 16 and her thyroxine level is thyroxine FT3 and FT4 level has been given. So our total cholesterol level has also been given. So what is the most likely diagnosis? Again, this is a very basic questions on thyroid disorder. In EDIC kind of examinations, usually this is a kind of more medical questions. The reason for putting this question is to start the discussion on the thyroid disorders, so that in subsequent sessions we'll discuss a lot of endocrine emergencies related to the thyroid disorders. So as we see that the answers has already been started coming. So this patient has some thyroid disorders. So what thyroid disorders this patient has? I can see that there are answers in the chat box. Dr. Hiren, Dr. Dikane, and Dr. Dattatray. So all of you have given answers of C. Dr. Ranjit has answers B. So Here, it's a very basic question. So the answer is the answer over here is the C. So it's a kind of Hashimoto's thyroiditis. This patient has hypothyroidism. So this is just to understand the whether we can identify this patient is hypothyroidism and the hyperthyroidism, and what is the most common cause of hypothyroidism in ICU. So that is what we need to know in from this question. Now, to start, whenever we try and interpret a basic thyroid function test, we start by checking the stimulating hormone. This is how, with an algorithm manner, how we understand what exact kind of thyroid problem we have. So we'll just check the TSH first. If the TSH is elevated, then it is either it is a primary hypothyroidism or it is secondary hyperthyroidism. If the TSH is elevated, if the TSH is low, then it is either it's a primary hyperthyroidism or secondary hypothyroidism. To differentiate between the hyperthyroidism and hypothyroidism, what we check? We check the T4 level, and depending on the T4 level, we differentiate what primary basic mechanism, basic pathophysiology or basic thyroid disorders we have. The commonest cause of primary hypothyroidism is autoimmune thyroiditis in Western scenario. So whenever you give the EDIC kind of exams, it is the autoimmune thyroiditis which is the most important cause of primary hypothyroidism. In Indian setting, the most frequent cause of primary hypothyroidism is the iron deficiency. So in any kind of exams, the autoimmune thyroiditis is the commonest cause of, which is the most globally most prevalent cause of primary hypothyroidism. And the most common cause of primary hyperthyroidism the Graves' disease is the toxic multinodular goiter. Now, two three important things that we need to know whenever we discuss the thyroid disorders is that uh, the T3 concentrations are of no value when evaluating hypothyroidism, because the T3 value are often normal due to T4 to T3 conversion. So we always need to check the TSH followed by T4. So that is important. And whenever we are evaluating or guiding the treatment for somebody, we need to test the TSH value, because that tells us whether the treatment, irrespective of the patient is hypothyroid or the hyperthyroid, whether the treatment are adequate enough. So TSH levels are more sensitive in guiding the treatment response. And to understand which blood test is the most sensitive to establish the excess thyroid or hormone activity is the free T3 level. So in any patients with a hyperthyroidism, to understand whether the patient is in an active endocrine hormonal level they are in the body or not, we need to assess the FT3 level or free T3 level. So this everybody needs to know. For autoimmune thyroiditis, we check the anti-TP antibody, and for autoimmune atrophic thyroiditis, usually they're associated. They're usually not associated with any goiter. And if you need to know that the common causes of hypothyroidism and hyperthyroidism, the commonest cause of hyperthyroidism is the Graves' disease and the toxic multinodular goiter, and commonest cause of hypothyroidism is the Hashimoto's thyroiditis, Riddle's thyroiditis, iron deficiency, and the lithium. There are few sets like amiodarone, postpartum thyroiditis, subacute thyroiditis, or dequirement thyroiditis. They can present both in the hypothyroid phase or hyperthyroid phase, depending on which phase they are